Okay, lower extremity, typically if we're doing these in a clinical setting, the person's usually laying down or we have some nurse support to help them, possibly on a table or rolling the chair, what have you. In this case, I'm just going to do some very slight, simple motions back and forth. If you have someone testing with you, make sure they hold on to something as they do some of these motions, in particular for the hip and also for the knee. So the hip is the other ball and socket joint that we're going to have aside from the shoulder. The shoulder is going to be very mobile, but it's going to sacrifice some stability. Whereas the hip is going to be slightly less mobile because it's going to be a lot more stable. It's going to be encased in ligaments around the acetabulum because the femoral head is going to fit nicely inside. Conversely, the glenohumeral joint through here, the ball of the head of the humerus is going to fit in a very shallow fossa of the scapula, so it's going to allow a little more mobility, but has more susceptibility of dislocation. Whereas the hip is actually more stable, doesn't dislocate very easily. So anyway, going through the same motions as we did before. I'll give you a little more space here. So we're going to look at the greater trochanter right through here is going to be the axis of rotation. And I'll follow the shaft of the femur. If I can see my knee right through here, we'll look for the lateral epicondyle is going to be the reference point. So again, we're looking here. That's going to be the first point. So we're looking at flexion all the way up through here. Sometimes I do this. So if you notice, if I try and do it with my straight leg straight like this here, I can't go up as high because my hamstring is going to very simply impede upon that. But if I bend my knee, take the hamstring out of the equation, and go further up. So again, right here is going to be the axis point. So that's neutral, that's 0. Take the measurement along the shaft of the femur down to the knee. That's going to be the angle there. And those of you doing this at home with someone else, make sure they're not flexing the pelvis at the same time. So a lot of times you can see the other knee bend as they're trying to cheat to bring the knee up a little further up. Okay, so that's for hip flexion. Now for hip extension, we're simply going to go backwards to the posterior through here. So right, so there's my reference point right through there again. So again, look at where my knee is. You know, use my other leg as a reference point as the other 0. Okay. Next, we're going to do abduction and adduction. So abduction, we'll look at the front of the hip here. So find your ASIS, and we'll bump right through here. Just inferior and also medial tapulator point right through here. So again, we're going to do abduction first, so it's going to go away to the lateral side. There's an axis point going out this way. I'm using my knee right through here to take the measurement of the angle, like a 0. Okay, next we'll do adduction. Now, of course, my other leg is going to block me here. So just do the shoulder and also the finger. We're going to go into a little bit of flexion this way here. And again, follow the shaft of the femur down to the knee through here. I'm going to adduct, so go towards the midline. So take the angle there. And it's not much compared to what we have with the abduction. The last we're going to do is going to be lateral rotation and medial rotation. Now normally we're going to do this on a table. Person lays on the back, they're going to rotate the leg. So it rotates out this way, it's going to be lateral. Rotating inward is going to be medial. So very simple, we're going to do this a little bit differently. So we're actually going to bend the knee like this here. We're going to look at the patella and the tibial tuberosity right through here. So that's going to be my 0 angle right through here. So if I rotate my foot out this way here and I rotate out this way, if I bend my knee, now all of a sudden my leg looks like this. This is what confuses a lot of students. Very simply, if I were to rotate my leg from here to there, this is actually external rotation of the hip. It doesn't matter what the lower leg does. So we're going to measure from here, right down to there. That's my 0 angle there. Rotating that leg outward this way, and rotating the hip. I'm taking an angle from that particular point there. Okay, and next we're going to go into needle rotation where my foot's going to swing outward this way instead. So normally it would be like this, but instead we could bend knee and rotate out like this instead. So again, with my kneecap, patella, as well as tibia tuberosity. So we're looking there, just my fingers as a reference, so I rotate out this way. Because this is tough to hold, I'm not going to hold it very long, so you have to pause it and take the measurement for me. Trying not to elevate my hip at the same time that I do this. Yeah, that should be 5. So that takes care of the 3 axes for the hip itself.